Thanks for inviting us to have this chat. I'm ASHLEIGH. I'm a trainee clinical psychologist and a mindfulness teacher. I'm working at the Imperial Centre for Psychedelic Research, and there I'm conducting some qualitative research looking into participants' experiences on clinical trials of psilocybin, DMT, and recently Roberta and I have co-founded the Association for Psychedelic Therapies, which is a professional network in the UK for psychedelic therapists.
So I'm Roberta, I'm a psychiatrist, but I also am specialising in my training in therapy. I met ASHLEIGH working in Imperial, originally on a trial for depression, but I've also worked on some trials for healthy volunteers and eating disorders. And my research interest is probably looking at the role of the therapeutic relationship in psychedelic therapy, and I've published on that recently.
What's the potential of psychedelics in psychotherapy?
So I guess I kind of look through a trauma lens, and I'm sort of specialising in the treatment of trauma. And something that the psychedelic therapy approach seems to offer is a way to come into contact with past trauma, which has a depth and a potential of processing an embodied kind of depth that allows people to really move through and to move into a new way of being in relationship with those past experiences. So I think for me that's really exciting. I also think it's a little bit treacherous because working with trauma is obviously an incredibly delicate and gentle and sensitive kind of work as well. So I think there's a lot to learn about how to do it well. But I think, that there's a lot of potential in that area, and that's something that excites me.
Yeah, I think one thing that's really interesting about psychedelics and quite unique is people will often talk about this idea of you tapping into your own inner healing wisdom. So there's kind of something about kind of being able to be in touch with that, which to kind of build on what ASHLEIGH just said, I think allows people to get in touch with those parts of themselves in a different way. And there's also something about the experience that I think when you're doing ordinary therapy, it can be a little bit more of a step-by-step, and sometimes people feel really anxious about getting stuck with the trauma, in between sessions without their therapist. And there's something about that big, full experiential process that can really happen on psychedelics that is quite unique. But sometimes I often think of psychedelics a little bit as like a kind of very snazzy Trojan horse right now that hopefully will kind of bring therapy as opposed to things like antidepressants or kind of more suppressant measures back into mental health services.
Do professionals need a specific training to work with psychedelics?
Yeah, I think that's a big question that, they were talking about that in a panel earlier. I think in our opinion that we would definitely think that it needs to have a very specific training and specific qualifications,
How the training should look like?
This is another really, really big question, and that's why we set up the Association for Psychedelic Therapies, because I think there are lots of things we need to think about. What do therapists need to know to be able to work with in order to be able to do the work well? There was a model presented earlier that brings into focus the complexity of the psychedelic experience and all of the different things that people can experience. So transpersonal, metacognitive shifts, relational insights or biographical insights, working with trauma, all of these kinds of things. So when we think about an experience which is so expansive, I think there are different ways to think about, can an individual therapist be trained to work with all of those experiences, or do we also need to be thinking about multidisciplinary teams of people who have lots of different skills, people with somatic therapeutic skills as well as kind of cognitive therapy kind of skills.
Spiritual.
Exactly. So we're asking a lot of one individual person, so certainly they're going to need a lot of training, but I also have a question around whether we need to be working in multidisciplinary teams to bring in enough expertise to help people through these enormous experiences.
Some professionals may be concerned about psychedelics can induce psychosis during the session, and they don't know how to deal with that. What would you say to them?
What would we do if someone developed a psychosis secondary to psychedelic use? Thankfully that's not something that we've ever actually had to deal with. I think it is quite rare. But I think that's a really interesting question, because I think sometimes the people who work in the psychedelic world have slightly different understandings of things like psychosis than the mainstream health services. And that can get really complicated because actually if we do a 6-week trial, we're delivering them back into mainstream health services where how it's managed might be, antipsychotics, admissions to hospital. For me, I would often see a psychosis as a kind of amplification of psychological defenses. It could be something to do with paranoia. I mean, I think there's always meaning kind of in the kind of experiences they're having. So that's the way that I'd like to work with it, but that's not necessarily the prevalent model at the moment.
I work right now in a psychosis service. I work in an NHS. That's our national health service, so where we offer free therapy essentially to anybody who needs it. And I work in a psychosis service there. And what I see a lot of is trauma, underlying complex trauma or single kind of incidents of trauma underlying those experiences as well. So I guess also being able to work with people's trauma.
Some people say that the most difficult experiences during the psychedelic experience are the most useful. Do you agree with that statement?
Yeah, definitely. There's something about getting in touch with, I guess, the parts of us that we don't normally want to get in contact, those sort of, disowned parts of ourselves, our shadow, also, old traumas, old memories. And actually, I think it's really brave, people who manage to do that work, to get in contact, and really, we witness such powerful healing when people are able to do that.
What I think is quite incredible is that participants who go through the trials and they go through these psychedelic-assisted therapy treatments, they do experience some incredibly difficult things, like, that Roberta's talking about, and they're incredibly brave going through those experiences. And they will talk about them as really worthwhile. So although they've been absolutely gut-wrenching and really incredibly difficult, they find them incredibly meaningful and really important to them. And I think that speaks to something in us, in our desire to heal and recover, and a kind of acknowledgement that actually that path and that journey is quite hard. It is difficult, it is fraught with challenge, but somehow it's really meaningful to be able to move through that.
And I think I would just say that we both personally would kind of, promote that as kind of part of our own healing experiences as well.
Yeah. And I would just add actually also that the beautiful experiences are also really, really valuable. So I wouldn't privilege the challenging over also the awe-inspiring and the majestic, because I think those also give people hope and an experience of something they may not have experienced for a long time when they've been suffering from a mental health problem, or possibly not ever in their lives. And that anchor into what's possible for them to experience and to be able to live like is actually really, really powerful as well therapeutically, I think.
Yes.
Do therapists need personal experiences, own experiences with psychedelics to be able to help with others with psychedelics?
I do think so. However, I was on a panel yesterday and I did share the story of having worked with a psychedelic therapist who is, an extremely qualified and competent therapist in the eating disorder speciality that the trial was looking at. And, she actually did a really amazing job of holding the space. Now, of course, I think if she was psychedelic experienced, she would have been even more amazing. But I do think that it can, I think it is important. But I would rather have somebody who's quite therapeutically competent, especially when working with kind of very complex clinical cases, that kind of thing.
And I suppose we can also problematise the concept a little bit around whether therapists need self-experience. Because if you, for example, only had as a therapist a couple of really positive psychedelic experiences, how much might that bias you, and how much might that then make you think that the psychedelic experience is one certain way? So I suppose there's something to think about in terms of what do we want self-experience to teach the therapist? What do we want to come out? What do we want to be known and understood? And I guess along with all of, having to hold all of our other biases and personal agendas in check, I think around our own self-experience is also important to bring that lens and that reflective focus to as well.
These psychedelic sessions often last for several hours, and that must be very exhausting for the therapist. So how can they mitigate this and do without burning out? What kind of supervision they need?
I think there's something really important about working in a pair that really supports that. I think being on your own in an 8-hour session is actually just not safe for you or the therapist. Nobody can kind of maintain that for that period of time, and you need to kind of be supporting each other. And also I think, supervision is often a bit lacking in psychedelic trials, compared to the kind of supervision that I would get in the NHS working as a therapist. So, I'd really love if that was prioritized a bit more in terms of kind of funding and allocation, that kind of thing.
Do psychedelics work for everyone, or they only work for a certain group of people and not for others?
It's a great question. I don't think we know yet who they might be. We don't know all of the people they may be suitable for. I think in terms of kind of, I guess, our own experience, our own clinical experience, some people find them too intense and they decide actually they wouldn't want to carry on with that treatment, that it was fine, it wasn't a harmful treatment, but they probably wouldn't pursue it. So I imagine in terms of personal preference, there will be people who won't seek it out as a treatment and may prefer alternative kinds of treatment. Do you want to add anything?
Yeah, I guess I would say that I think it's important as a research community that we start small, but I am aware that the kind of scope is getting wider and wider. I also think we need to think about, in what context are the psychedelics being delivered? Is it a very short-term trial with very little support? Is it in a kind of clinical context at the point of legalization where you can offer loads of support if someone needs it? There might be kind of short cases, long cases, and also, what are the expertise of the team? What are they able to hold? Can they work with psychosis? It's a very complicated question, I think.
Yeah.
Do previous recreational experiences with psychedelics can affect the therapeutic experience of patients?
I suppose it would depend. I suppose it would depend on how many recreational experiences, how that person has made sense of those experiences and what they were like. I guess what comes to mind is if somebody had a very challenging experience previously, that might make it harder for them to let go in a therapeutic. It would be scarier, understandably, because if they've had a really hard experience before, they might imagine that would happen again. So you might have to do some work around, first of all, helping them to just feel safe enough with the psychedelic. Which is where it would be great to be outside of clinical research settings, where you'd be able to give somebody a smaller dose and build up and build trust with the substance and the therapist, I suppose. Yeah. Probably lots of different possibilities with that. Yeah.
In your experience, is there any gender difference between how people respond to psychedelics?
The only thing that I'm aware of is that I know a couple of studies have picked up on women having higher scores in challenging experience questionnaires. That just popped into my mind as you were speaking. Now, this is sort of observational, community-based studies. It's sort of nothing that came up in our research, but that's the only kind of awareness. Now, you could kind of interpret that in lots of different ways, but I suppose that's kind of the only factual kind of published difference that I'm aware of.
There is much hype around psychedelics right now, very high expectations. Do you think that can turn into disappointment later?
Who will be disappointed? The patients, the therapists, all of us? Will we all be disappointed? Yeah, I suppose again, in our clinical experience, to go back to the clinical room, that's already happening. People come with a sense that one treatment or two treatments might be able to cure the symptoms that they have and make things completely better and recovered. And I guess the reality of healing is actually it's much more complex than that. It usually takes longer. And in a way, this is something that happens with all therapies, I guess. The same was with cognitive behavioral therapy. There was this huge hype. It was going to be this most amazing thing, and then it kind of came down the other side, and it's now on the point of people saying maybe it's not so effective. So I think these trajectories happen. I think that there will be disappointment for participants.
I think it happens in all kinds of therapies. Even, I offer sort of long-term, year-long talking therapies to patients in the NHS, and sort of almost an inevitable part of that process is their kind of slow, dawning realization that actually, and these are people with kind of a lot of complexity, a lot of trauma, they're quite sort of high-level kind of services in NHS, realizing that actually healing takes a long time, that it's kind of a longer healing process. And I guess there's something about psychedelics that kind of feeds into that fantasy of a magic bullet. But I think that's everywhere with antidepressants, with CBT. You know, it's nothing unique. It's just a lot in the media.
Do you have any personal preferences working with any specific substances among psychedelics?
I guess I'm fairly open-minded about substances to work with. I've worked most clinically with psilocybin. But I can really see real possibility and benefit with MDMA, and I'm even open to the idea of LSD, even though that's a much longer experience, and so for the therapist that's a much longer day and much kind of, longer work really. But I guess I'm curious. I'm also a researcher, so I'm really interested in how the different substances work and how they work differently therapeutically. How about you?
I guess obviously clinically I'm most experienced with psilocybin. I'm really quite interested in working with MDMA as well. I mean, LSD I suppose I would put a little bit into the category with psilocybin, whereas MDMA seems to work in a slightly different way. So, you know, I'd love to do the training or have that experience, but just in terms of what I'm comfortable with and used to, I guess it's psilocybin.
There were some much publicized scandals around psychedelic sessions with sexual abuse. What do you think about the ethical requirements of these sessions? How can we improve them?
Yeah, I mean, I think in part that was what really made us so interested in setting up a professional body. I think, I mean, those kinds of boundary transgressions, and particularly sexual ones and relational ones, have a long history actually throughout all kinds of professions, but in particular within therapy. So it's, you know, sadly not something that is unique to psychedelics. But there is something about, I think, the intensity of the experience, and if I'm honest, the fact that it's sort of in this slightly no man's land in a way. You know, there's lots of people doing the training that don't belong to a professional body or an organization. Some people are using touch in a way that they're perhaps not trained to do. I mean, the boundaries can get a bit unclear, which is sort of why we wanted to set up sort of a place where we could kind of consolidate in a way our thinking and our understanding about how best to kind of safely support these experiences.
And think about what safeguards need to be in place and put out some, you know, kind of guidance around how do we keep these therapies safe, but also to think together as a community about how do we set up accountability processes, how do we respond as a community individually, what do we need? You know, therapists have existing regulatory bodies that clients could make complaints to, but whether they know about those routes, and there's not much link between psychedelic therapy and those bodies, and so it's quite, as you say, a kind of no man's land where a lot can happen in it right now, and that's not safe for the patients. I think it's also important to educate the patients, so that's why we need to know ourselves what the boundaries and the guidance is, so then the patients, the participants on trials can know, and then they have some empowerment also to know this is right or this is wrong, or you know, how to kind of navigate that space a bit better for
and somewhere they can go to ask, you know, is this okay? What do you guys think? At the moment there's kind of nowhere to go.
Yeah.
Actually, you worked with ayahuasca in Peru, and now there are more and more ayahuasca sessions happening in Europe. What do you think, how should we make sure that people are not abused in this context, and there is a quality in these sessions?
Yeah, I think ayahuasca for many people in traditional and in kind of neo-shamanic also context is a sacred, ritualistic experience, and I guess religious freedom is one way to bring safety to that, so that people don't have to practice illegally to be able to engage with a spiritual practice which, you know, involves this sacrament, which is the ayahuasca vine. I think that would go quite some way, giving people permission to be able to practice their religious beliefs, their spiritual beliefs, their wishes to do that. I think that could help bring quite a lot of safety, because it would bring things up from the underground. People wouldn't have to do it in secret. There could be networks that would regulate each other, kind of self-regulate. So I think, legalization is a big problem in the clinical context and in those contexts as well.